we are going to go over pulmonary pathologies or diseases of the lungs and airways. The first thing we're going to cover is chronic obstructive pulmonary disorder, otherwise known as COPD, and these are diseases that make it difficult to exhale air out of the lungs. So under the umbrella of COPD, we're going to be looking at emphysema, chronic bronchitis, and asthma. First off, with emphysema, it is a chronic disease that causes destruction of the alveoli, which are tiny air sacs in your lungs that do gas exchange. Causes of emphysema is going to be smoking as the biggest culprit, and then air pollution. And emphysema can also coincide with other forms of COPD, like chronic bronchitis. Effects you'll see are shortness of breath, wheezing, fatigue, and then you'll see patients with barrel chests, so that constant, big, expanded, rounded chest. Best treatments are going to be to stop smoking, which will help slow the disease process, but it won't reverse it. And then breathing strategies such as pursed lip breathing. Chronic bronchitis is long-term inflammation of the bronchial tubes or the airways, which causes persistent cough with mucus for at least 3 months and 2 consecutive years. Again, smoking is going to be a big culprit for this, as well as air pollution, chemical fumes, and repeated respiratory infections. The key thing here is that with chronic bronchitis, you'll see productive cough, so cough with mucus, along with that shortness of breath and wheezing. Next, looking at asthma, it's a chronic condition where the airways become inflamed and narrow and produce extra mucus, making it hard to breathe. This will most often be caused by genetic factors as well as environmental triggers. And you'll see that wheezing, shortness of breath, and chest tightness, and it'll be characterized by attacks that will require emergency attention. To treat it, you can use inhalers and oral medications or find ways to try to avoid those allergenic triggers. We're going to look at cystic fibrosis as well, which is a genetic disorder that causes the production of thick, sticky mucus, leading to severe respiratory and digestive problems. This is a genetic disease, so a person needs to inherit 2 copies of the mutated gene, 1 from each parent. With this, you'll see chronic productive cough, wheezing, shortness of breath, as well as those digestive issues. And for physical therapy, we can do chest PT, which would be things like postural drainage. Next, we're going to look at restrictive lung dysfunction, which deals with restriction of expansion of the chest wall or lungs. So in other words, the volume of air moving in and out of the lungs is decreased in these disorders. Here are some examples of restrictive lung dysfunctions. We got pulmonary fibrosis, sarcoidosis, and chest wall deformities like pectus excavatum and kyphosis, which is that rounded hunchback-like spine. There will be similar treatments for RLDs, medications. Again, those diaphragmatic and pursed lip breathing techniques will be super helpful. And as always, lifestyle changes like quitting smoking and weight management will be helpful as well.